This is the third year that the bill has been brought up. It is nothing more, in our opinion, than trying to create complete immunity for a segment of the healthcare professions. And in the context of what happens in a hospital, it would be a pretty wide swath of care and treatment. The emergency room, patients that go into labor and delivery through the emergency room, surgery. In our opinion, there's simply no valid justification for this bill whatsoever. That doctors are fleeing the state, the evidence shows the exact opposite. We rank number 5 in the country in terms of emergency room physicians. The other ostensible justification that there is a high-pressure liability environment in Michigan is simply not true. We've proven this time and time again. Last year, there were a grand total of some 800 medical malpractice cases filed in the state. That's it. The number of malpractice filings has diminished by over 80% over the last 30 years. The idea that people win big verdicts with jackpot justice in Michigan simply is not true as well. We have damage caps, significant limitations on recovery. Michigan ranks 8th from the bottom in terms of the amount of money that is paid out in medical malpractice settlements. If it becomes the law, it would create a dual standard of care. Gross negligence or complete immunity for people that come into the hospital through the emergency room, or the standard of care, which is what all professionals are required to meet according to the standards of their profession, for other patients that were just in the hospital electively having surgery. So one class of patients would have no recourse for substandard care. The other would have the current system as we have it. Well, the current law, we've been through 2 rounds of very significant tort reform in the state of Michigan, 1986 and then 1994. 1994 adopted firm damage caps, limits on what can be recovered in Michigan. It enacted all sorts of procedural requirements that patients must meet and their attorneys must meet before they can file a case. And the impact of that legislation alone has caused a dramatic decrease in the filings of medical malpractice cases over the years. Yet time and time again, we see efforts by the medical insurance industry, the healthcare professions in Michigan, to ask for more and greater protections when they're not needed. The ostensible justifications for this bill are non-existent.